leg and the behind of the cat.
Okay.
So right here that you are looking at, this big muscle right here, this is your gluteus medius. This big muscle is gluteus medius. This is gluteus maximus. So just like pectoralis major and minor, you have noticed that maximus is smaller than the medius, right? So these two are the glutes. This one right here is caudo femoralis. Caudo, tail. Okay, so it is attached to the tail. You can see the tail, and you will remove the skin to see the tail. So this is caudo femoralis. Why femoralis? Because it is coming in and getting attached to this bone, right? The thigh bone, which is the femur. Hence, caudo femoralis. Okay. So that ends the behind. Now we are going to do the back of the leg. This muscle, which is thin and long, this is your semitendinosus. Okay? You see this big bulky muscle? This is your biceps femoris. Okay? So this is your biceps femoris right here. Now underneath the semitendinosus, you see this muscle? It is pretty bulky. Okay? This muscle. This muscle. It is pretty bulky. This is semitendinosus. Oh, sorry, semimembranosus. So this is tendinosus, thin. The bulky one is, semimembranosus. Do you understand? And if you separate it out, this one, let's separate it out, then you can see. And again, for separating, put your this probe on the fascia and always cut where the fascia is. Okay? Now what I am doing is I'm separating the muscle at the fascia, and by doing that, and I am cutting it on my probe, so I am not killing the muscle. Now when you remove that, hold it for me, don't pull it. This is the back side of hamstrings. I'm sorry, this is the back side of the quads. These are the hamstrings, right? Semitendinosus, membranosus, and biceps femoris. These three make your hamstrings. These are your quads from the back side. Okay? And then you can see it from the front. Now, on the side, you see this fascia and this muscle? Teeny weeny muscle here with the fascia. Can you see that? Huh? Hold it for me again. And let me kind of separate it out a little bit. And this right here basically is your this that you are looking at. Okay. So this muscle, no. This muscle right here is tensor fascia latae. Okay? This muscle right here is tensor fascia latae, and this fascia, this is iliotibial tract. Do you understand? The fascia is the iliotibial tract, and this is tensor fascia latae. Okay. So this is the back of the thigh. So we did back, we did the behind, then we did back of the thigh. Is that clear or not?
Yes.
Any questions so far? No? Okay. Now we are going to do the leg. So, in the leg, you are going to trace the muscles from back to front. Okay? So this is how it goes. You see this bulky muscle? This is your gastrocnemius, just like humans, right? Very bulky. And it is joined with another muscle, which is soleus, and the two together join the heel as Achilles tendon, right? So this is your what? Gastrocnemius. This is soleus, right? Next to it is your this muscle, right? This muscle. And you can shift the cat a little bit, and then you can see. You see this muscle right here? This muscle? This is your peroneus longus. Do you understand? That is your peroneus longus. Inner to it, you see. Oopsie. Okay, now you see this muscle, this one. This muscle. Extensor digitorum longus. Extensor because it is going to extend the leg. Digitorum, it is going to the digits. Longus, it is long. Do you understand? Extensor digitorum longus. You see this muscle? The one which is in front? This is called tibialis anterior because it is on the tibia and it is most anterior one. So, gastrocnemius, peroneus longus. Oh, I'm sorry. This is gastrocnemius. This is soleus. Peroneus longus, right? Then you have extensor digitorum longus, and this is your tibialis anterior. G, S, P, E, T. Good. Students, pass every test. Okay? So that takes care of the leg on the back side. Now this is extensor digitorum longus. On this leg, if they ask you on this leg, on the inner side, if they ask you for this muscle, this is flexor digitorum longus. Whatever they ask you on the inner side of the thigh, don't think twice. It is only flexor digitorum longus. So extensor is on the outer side, flexor is on the inner side. Do you understand? So that is your posterior, or not posterior, back of the thigh and the back of the leg and the behind. Now flip it for me please so I can show you the front. Okay. Now the front is going to have a couple of things, and let's look at those. This muscle right here, this is your sartorius. Okay, this muscle is your sartorius. One which is on the inner side This is on the inner side, right? Closer to your midline of the thighs. That is your gracilis. This is your gracilis. Understood? So you have to separate it out from here and cut it right here. Okay? Cut this one here as well so you can lift it up and look at the under muscles. Same over here. So the one which is near the midline of the thigh, that is gracilis. The one which is on the outer side, that is your sartorius. Clear? Let's look at the structures underneath sartorius. And underneath sartorius, you are now going to see the quads. Remember I showed you quads from the back? Okay. So quadricep muscles, they are going to be vastus lateralis, right? It is present laterally. This right here is vastus medialis, present medially, right? And this in the center is your rectus femoris. So this is like the hot dog, okay? So this is your, what? Your
Rectus femoris.
Yeah, which is the main hot dog, right? This is the upper bun, which is
Lateralis.
the lower bun, medialis. And when you lift it up, so you cut it kind of towards the end so you can lift it up. And when you do, you see this structure in the center? Can you see that? This? Huh? This right here is your vastus intermedius. Think of it like mustard. Okay? So this is your hot dog setting.
Okay.
Is that clear? Okay. This hot dog setting or quads were present under the sartorius. Do you understand? So that is how you can remember above the hot dog is sartorius. Now gracilis. We are going to move this and then we are going to see the muscles underneath it. This muscle right here, the tiniest one, this right here. Are you looking at it? This is pectineus.
Yeah, okay.
This is pectineus. Okay, this is pectineus. Next to it is adductor longus. Adductor longus. So this right here is your adductor longus. You see this big muscle from here to here? Huh? And don't think that, oh, there is a separation here, this is another muscle. No, it has two heads. So you can see from here all the way here, this entire muscle. Don't think this is another muscle. You can see this demarcation right here, right? But it is not another muscle, it is one big muscle. This is called adductor femoris. Now there are way too many femorises here. Adductor femoris, rectus femoris, biceps femoris, and people always mess up in those. So pay attention to the name. This is your what? Adductor femoris. And this right here is your semimembranosus that I showed you from the back. And of course the semitendinosus was right here, right? So if I separate it a little bit more, then it may help you to remember a little bit better. Right? So this is your semitendinosus, semimembranosus, which were part of the hamstrings, right? But you can see it from both sides. So the muscles that you can see on both sides, they can ask you from any side. Is that clear? This muscle right here that I was showing you and is on the inner side, not on the outer side, this is your flexor digitorum longus. Because it is long, it is going to go to the digits. But this is flexor. Outer one is extensor. And that is all for the leg, front, back, thigh, front, back, and the behind. Is that clear? So go and work on it.